I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you.
Everybody had a chance to review the minutes? Need a motion?
Make a motion to accept. Second.
Second. All in favor?
Aye.
Opposed? Carries. Doc?
Okay, we have three resolutions for your approval. And the first resolution is, for purchase flu vaccine and not biological and, oh no, not flu vaccine, actually, yes, it's for medicine for STD. It's already in the budget, and I can tell you this medicine, the price increased drastically from like probably 4 or 5 years ago, $99 a dose, now over $400 a dose.
So why do they have?
Why?
Just price gouging, or is there a?
I don't know.
Okay.
It's a price gouging or short of supply because many antibiotics short of supply.
Okay, understood.
We have a motion?
So make a motion. Oh, I'm sorry.
Second.
Motion.
I can second it. Second. All right. Any further discussion? All in favor?
Aye.
Opposed? Motion carries.
The second proposal is authorized to create a temporary position in the health department, and we have a very dedicated and very capable senior accountant. He's going to retire, and this will be a big loss for our department and for the country, because I frequently mention, yes, I wish we can duplicate or clone him many times, but his retirement will sure have a gap, and really this temporary position will help us to have a smooth transition. And this proposal will create this temporary position will not add any to county's budget, and will within departments this year's budget, and we will make it happen.
That motion, please.
So moved.
Second.
Any discussion?
The only, I read this over. What bothers me is when it says employee has been solely responsible. I don't think that ever should be something in the county, that one person is responsible for a huge budget. They should have a backup all the time, not solely responsible. I mean, you almost need an assistant, that's what I'm saying. And, because if that person dies, that person gets sick, also we're left with nobody.
I'm so sorry, legislators, and the reality is in our department, so many people solely responsible for many things, not just this one position. And for example, just me as an example, I don't have executive. If I'm hit by a bus outside, and I don't know.
Ultimately, he's responsible. He's not solely, he's only responsible under his authority, but he's responsible.
That's my own.
Yeah. I understand.
They need cross training.
It's a really difficult, because we have such staff shortage, and if not my example, I can give many examples. Our direct patient service, our direct preventive services, and they have a lot of knowledge and experience, but it's very, very hard. We have a system to share this knowledge before people get promoted or get retired. It's really, really tough. And always I say yes, somebody needs and brought away a lot of institutional knowledge and history. It's so challenging. And go back about 3 years ago when our this environment health director retired, and yes, really, the whole environment health department died. And when COVID-19 started, the 3 senior sanitarian retired, and immediately we don't have staff to do basic work. I'm sorry. It's the reality.
You good?
Yeah, I'm good. I'm just concerned that that's the tough thing to do.
That's a good point.
I want to thank your department and you with all the stuff that's going on. You've done a great job.
Same here. The team is wonderful. It's really so dedicated.
And with the flare-ups. Okay, all in favor?
Aye.
Opposed?
Okay, the last resolution asked you to approve is the budget modification for air spraying, and we did the air spraying last week Tuesday, and this was successful, and we choose to spray usually almost every year spray that this Route 49, Route 11, this corner of on Nida Lake, and it's notoriously mosquito breeding site. So we sprayed it, and because this is not in the county budget, and the advantage of not in the county budget is because we can get the state reimbursement at the favorable rates. So this is your approval.
Doctor, can I ask a question?
Yeah.
Lyme disease is not only spread by mosquitoes, it's also spread by ticks.
Yeah, Lyme disease by ticks, not by mosquitoes.
The reason I know this, I know a gentleman that's going through this process that got it from a tick. So is our public aware that this is very possible?
Yeah, I think every year we send out press release, and also other channel like community events, and I didn't bring it with me. We made this small tick remove kits and distribute in the community. And like last time, I think senior fair, and we brought it there. And we do our best to make this aware in the community. Especially, I heard anecdotally, because we don't have ticks surveillance system, and I heard many people told them this year ticks a lot. And also, we promote another resources is this very unique for New York State is upstate medical universities. They have vector-borne disease lab, and you can free test ticks for free, and you just need to mail them, and you pay the postage, and the website we promote is nyticks.org, and if you go online, fill out the form, follow the instruction, mail the ticks, and they will email you the outcome lab results. So this is what we are going to try to promote this prevention.
Well, I think the concern is that, I just happen to know this part, was involved with wood selling and all that, but I don't know how many people realize ticks also, and as we all know, we have ticks because we put the mulch around the house and all that kind of stuff, and ticks love that kind of air, atmosphere, mulch around the house. So
Yeah.
I just want to make sure that we're making known that a tick is just as bad as a mosquito in the sense of being able to spread it.
Yeah, yeah. And the tick is really as bad as mosquito, because mosquito, if triple, you kill people quickly, and the ticks really chronic deteriorating for many people. And since I came here, I heard, yes, a county woman, and she even cannot hold a plate because of delayed diagnosis.
This individual's a hard-working man and everything else, and now he has this Lyme's disease from that time.
Yeah.
Good.
Thank you.
Look, need a motion.
So moved. Second.
Second. Any further discussion? All in favor?
Aye.
Opposed? Motion carries. I'll send you the sheets now.
And yes, last is a memo and need your endorsement, is a vehicle assigned to hospice employee, and as you all know, this hospice services 24/7 on call, and we have less than a handful of nurses, and they are located to be on call, and this is for the safety for them as well. It's not just convenient.
Need a motion.
Make the motion.
Second.
Second.
Any discussion? We've done this before, we don't know what it is. All in favor?
Aye.
Opposed? Motion carries.
Thank you very much. And
Up again.
okay, yes, my report, and yes, before I start my report, and I wanted to introduce our county healthcare agencies and the nursing homes, and they came to talk with the community about their challenges because of COVID-19 and its afterward impact. And I'm very sorry to every one of you. And yesterday I made a mistake and say yesterday was the date and the time here, and you came here. And eventually, yes, no, it's today. I'm sorry. And now I think this is your podium to make a presentation. All right?
Why don't we start with introductions first?
Well,
One man or the other.
what do you want to do? You want to go around the room?
I could do introduction.
Go ahead, Jason. Go ahead, Jason.
So, my name is Jason Santiago. I'm the Chief Operating Officer for Seneca Hill Manor here in Oswego.
I'm Andrea Joviak, I'm the administrator at Morningstar Care Center here in Oswego.
I'm Joe Morbillo. I'm the owner operator of Morningstar in the Gardens. We have 3 other facilities in 2 other counties, similar situations.
Good morning, I'm Greg Ostetic, Director of Community Relations with the St. Louis Family of Caring, St. Louis Health Services, Bishop's Commons, and St. Francis Commons.
And I'm Kathy Gill, and I am the CEO for St. Francis Bishop's Commons. Same as what he said.
Good morning, everybody. Mike Beck is COO, EVP, Oswego Health. Good to see everybody again.
Good morning, everybody. I'm Dan Young. I'm a consultant with Oswego Health with Bartley Damon.
Do you need introductions around the table? We're all legislators with the exception of Phil.
Phil Church, County Administrator.
Sean Porter, Executive Legislator.
Yes, Jin.
We know you. We know you.
Ching Chang, lapse of memory. It's your show.
Well, I'll just start, and then I'll kind of turn it over to Jason and kind of have, I think, kind of the intention, at least from what I was shared, was that we talk a little bit about what skilled nursing especially has really faced throughout COVID-19. And while it might have been an error yesterday, Ginseng, it was good at least to come back to the building, and it's good for me to see everybody. And before I go any further, I just want to give Renee Fox a shout out. In the year that I've been over to Oswego Health, Renee has done a tremendous job in helping us with the EMS partnership. We work very, very closely together with a lot of members on our team at Oswego Health. But given this opportunity in front of the legislature, Renee, thank you. Good to see you yesterday too. So in the year that I've been over to Oswego Health, certainly COVID has dominated the entire conversation, and certainly it's impacted us in a number of different ways, and I'm sure my colleagues can kind of share and outline a lot of similar stories that we're continuing to face. And I will say that it is not something that we faced in past tense. It is something that we face right now today. There is a uptick in your community, in our community right now here in Oswego County. It is significant, and it is something that we all need to take very, very seriously. This COVID Delta variant is certainly impacting us in a number of different ways. We are seeing it in our ED. Our ED and our urgent care numbers, I'll just share that from the hospital side of things right up front. We are back to pre-pandemic levels. So you did see a decrease of people saying we don't want to come into healthcare for a while. Those numbers have now considerably risen up, and we're actually above, some year-to-date numbers from 2019 currently at the Fulton Urgent Care, Central Square Urgent Care, and then certainly our ED here in Oswego. And it's a lot of folks that have either delayed care, and some folks that have some of those. We're starting to see some folks with more of those bronchial issues, breathing issues that we started to see pre-pandemic before masks became a regular part of our being. We didn't kind of see that last year, but we're starting to see some of those things come back now. And obviously that impacts our entire community in a number of different ways. I'm sure all of my colleagues here will talk more about the workforce challenges that we're all facing and considering kind of seeing what we want to try to do going forward. I will highlight that I do have an ask in front of the legislature, and Phil certainly is aware of this, for some workforce development monies within the American Rescue Plan. I know you're all kind of putting together your framework of how that application process will go, but I really kind of put that in there to kind of say there's a way for the county to help do some RN recruitment, and in particular some skilled nursing, some skilled labor, licensed labor recruitment. That would really help, I'm sure, all of us in a number of different ways. Getting more people into the county with licensed medical certifications would be very helpful. And then I know Joe Morbido being here, if I didn't mention CNA recruitment, he'd really have a problem with me later on today. Certainly CNA training classes would be another piece of that as well, that I think we could work on a collaboration with the county to try to develop some training courses that would help all of us as well. Because truly it's a labor shortage that is a national problem, but it's just exacerbated here in our region in particular, because we always fight with Syracuse. It's such a close-knit, the running joke, you can get anywhere in Central New York in half an hour, 45 minutes. That's very real. So we're always kind of stealing from one another and raising rates and paying travel numbers and sign-on bonuses, and it really gets to a point where it becomes almost unsustainable. So well, we've come through the pandemic, knock on wood, in a pretty solid place. We're back to our elective surgeries are running well. We're in a pretty good place from a performance perspective, but the labor shortage is something that we're very much watching. The vaccine mandate, which I'm sure all of you are aware of, it came up from the governor's office. It's something that we're monitoring right now and trying to evaluate. And I'll just leave it there, and then I'll turn it over to Jason. Jason can talk a lot about Seneca Manor and Springside, and I'll give Jason a quick shout out. He's done a great job of working with our state legislative partners, especially trying to push out to our community, talking about, to Patty Ritchie, to Will Barkley, to other regional elected officials, saying these are the challenges in Oswego County, but they're also challenges regionally. He'll talk about Leading Age, I'm sure, in a minute, Maine Trade Association, who each continues to work and try to focus, kind of push their statewide advocacy in a direction that will lift all of our votes. So, sure. Jason, why don't you take it from there?
Sure. Thank you, Mike.
Thank you.
Best way I could describe and piggyback on what Mike is saying is, our industries here collectively, it's on fire right now because of workforce issues. The beauty of our organizations, though, is that even though we are competitors, we are serving the same people, and that's our local constituents here in Oswego County. And even before the COVID outbreak, we've been collectively working together to how we can better serve the community. And we've all got hit with COVID in our respective facilities in some way or another. Our nursing home industry has had staffing issues even before COVID. But then, when we got to the point where COVID hit our facilities, it was a difficult time for us all, to be able to provide high quality care to our respective residents of our facilities. But we were able to work with Oswego Health to be able to share resources within not just Oswego Health to Seneca Hill Manor, but also how do we help our fellow peers here that are all facing the same situation. What we didn't foresee coming though was what happened after our outbreaks that we've had, where we've had an exodus of CNAs in our facilities. I can tell you right now, at my facility at Seneca Hill Manor, I have 21 open CNA positions right now. That's difficult to manage. Difficult to manage high quality care for a facility like ours that's a 5-star quality facility, and we want to continue to do that. I think we could all speak for each other. We all are committed to giving high quality care. What we're facing right now is a mandate for vaccination in healthcare across the continuum. And right now I have 77% of my staff vaccinated. The problem is that I have a significant amount of CNAs and LPNs that have not been vaccinated. So you take the open positions that I have of 21, and you add the amount of 27 total in nursing, in the nursing department as a whole. That mandate goes into effect September 27th. That leaves me in a position, us in a position of, and I'm sure my peers will share similar stories, how are we going to be able to continue to deliver the high quality care we've been doing for the last several years successfully when you're looking at those numbers? Frankly, it's impossible. I have been on the phone hourly at times with Leading Age, as Mike mentioned, which is our state healthcare association for not-for-profits. I'm sure my peers have been calling their local legislators and associations as well. Right now, it's a ground and pound message, is the best way I can put it, and that's why we're here today, because we need to make you all informed of the fact that, at Seneca Hill Manor, I'll speak for myself, with 103 residents right now that I have in the facility out of 120, I'm stretched right now to staff that building successfully. September 28th comes, I have to have a plan between now and September 28th. What do I do? What do I do if those unvaccinated folks choose not to get vaccinated? How do I give care, not myself, but how does the facility give care to those people that need the care, the most vulnerable? There's not enough advocacy we can do to this. We have to be doing this on an hourly, a daily basis. Year over year, even before COVID, we've had an increase of people leaving the long-term care workforce. Again, this is not new to just COVID. This is something that we have made and rang the bells and alarms at the Department of Health state level. And unfortunately, it's gone unheard. And right now, like I say, we're on fire right now, collectively. And we're making those calls, we're making those efforts to be able to see what is it that the state can help us do to successfully meet the needs of our residents. As Mike mentioned, American Rescue Plan dollars. Is that something that can help us as long-term care folks to continue to provide high-quality care that the county can assist us with so that we can help eventually stabilize that workforce? That's really why we're here today. And I'm glad and I'm proud to work with this group of people here because, like I said, despite all of us being competitors, we're here. We have 500 residents potentially at full capacity that we care for in this community. And we want to stay in business for this community. And right now, we need the assistance and make the county legislature aware of what we're facing. And I'll leave it up to any of my peers if they'd like to add anything to that.
I just have one quick thing, if there's two takeaways for me from this. I think, both have spoken very well, and, we've never worked with the county health department, Oswego Health, and the 3 skilled facilities more collaboratively in this pandemic ever. We always have worked together, but not in this capacity. But two takeaways for me, if you're not, the hearings, that is difficulty with labor right now, especially CNAs and LPNs, when we compete with Fast Track and McDonald's right down the road at a minimum wage of 15, and you want someone to come into the nursing home and actually care for somebody and give a bed bath and be at a bedside and deal with COVID at a very similar rate, if McDonald's isn't even more. And then the next thing too is, not only is it about the labor force and some of the challenges that we're facing, but also what it is doing to the members of our community who we are not able to admit right now. And Oswego Hospital is not able to discharge. I've never seen more people in need of a bed, and we can't offer a bed to our local residents because we don't have the staff. So we're a 120 bed facility, and managing at a census of 98 to 100, where that's not sustainable. But is it safe to go? You can't go to the levels. We're the whole same size. He's at 103. We're around that way too. And it's because we can't admit them. So when the hospital is able to discharge them, they're going to a facility in Onondaga County or Monroe County. They're going somewhere else. They can't even stay here in Oswego. So those are just two things that I think that it's important that you all know.
And just to put numbers to what Andrea just said, from May 1st to July 31st, 31 residents of Oswego County had to go out of county to receive long-term care. That may not sound like a lot, but that's more than I've ever seen in the 7 years that I've been here at Oswego Health that had to go out of county that could have stayed local.
You have there's so many variables in those statements just to understand it. And I know y'all don't work in healthcare, but there's definitely a perfect storm of things going on right now where, the healthcare facilities at any level, assisted living or skilled or hospital-based, we don't set rates. So we're Medicaid, Medicare, third-party insurance. We don't set rates. Most businesses can change the cost of the pizza. They can impact revenue. So in our case, we do not set those revenue rates. You have the floor, and the intention of minimum wage increases, this isn't here to be a rant about that. That's going where it's going. The intention is to try to help people have a quality of life, understand that. It seems like there needs to be some more attention paid to some of these other, especially healthcare part of the job sector, where you're kind of caught in the middle. And to Andrea's point, when you look in the past, we've always been well above minimum wage, understood what minimum wage was, understood what our other non-healthcare market wage rates were, put ourselves in a place where you're recognizing people's work and time and effort to be in healthcare. We say all the time in our group, you're not in healthcare by accident. Most people that are in healthcare have chosen to serve other people. They don't want to make cheeseburgers, and nothing against cheeseburgers or those people who make them. My son eats a lot of them. But the point is, people make the decision to be in healthcare because they want to serve other people. Some of these dynamics have really caused people to really reconsider how is their time best spent. So the minimum wage influence is part of this picture. The other part that I just want to stress is the regulatory intent. Let's look at COVID during the outbreaks. I am not a clinician. I just play one on TV, and I work with a lot of our doctors and nurses, and we've done a lot of really great things in multiple counties. All of our buildings, our Oswego County buildings, Morningstar was able to keep COVID out, which kept it out. That says a lot. Our gardens, we had an outbreak, and it was probably one of the best collaborative efforts that I can even think of, what we did at the gardens between the hospital, and we were able to have 42 cases and nobody passed away. Dealing with the clinical side of COVID, everybody in this room was pretty well prepared to deal with. Supplies, clinical efforts, collaboration, so forth. This county, and I work in 3 different counties, this county collaborated better than the other 2 that I'm familiar with. I mean, whether it be Jen Chang in his office, or the hospital, or our peer group. This group collaborated much more openly and fluidly than the other counties. So handling the clinical aspect of COVID, no one wants to do it again, But everyone is fairly well prepared to deal with that. It's an infection. We deal with infections all the time. We deal with flus all the time and different things, and this is its own thing. But this year, post-pandemic, just to piggyback on some of Jason's point there, the fallout, the regulatory fallout, the politicizing of COVID, finger pointing, the surveys, the punitiveness, the fines. You know, when you're looking at the frame of mind of the healthcare workers who have been through 18 months of clinical difficulty and managing the clinical outcomes and so forth, you know, moving into January, February, surveys began again. Surveyors came out of wherever they were, homes, and, you know, we had suspended surveys. You had multiple infection control surveys. You had state surveys. You had federal surveys. You had fines and a lot of Monday morning quarterbacking going on. That when you keep stacking those influences on the frames of mind of people, in particular the effect it has on the direct care. You know, I guess we signed up to deal with some of this sort of stuff. You know, the bureaucratic politics. We're all either owners, operators, administrators, CEOs. We kind of signed up for it. But there's a lot of people that haven't signed up for it. They signed up to take care of people. They signed up to be nurse aides. They signed up to be, you know, dietary assistants and cooks, and every single one of them is dealing with it. Post-COVID stress is probably worse than the COVID stress, because during COVID, you know what you had to do. I got to do these 5 things every day, and we got to keep it going, and we kind of like pull it in, and everybody, you know, pulled themselves together and operated well as a team in all these individual buildings. The net after effect and the stress, whether it be from financial or regulatory or the market influences, I don't know that from a regulatory point of view, enough time is being spent to look at the collective frame of mind of the people who are working. Because I think it's very destructive what's going on. Jason says, well, you know, it's on fire. We're not here to exaggerate. I think that the ongoing stresses and strains are really alienating a lot of frontline direct caregiver workers that we need. And I don't think enough time is being spent understanding their frame of mind, in particular with the vaccine idea. I don't think anybody's going to argue that a vaccine is a good idea and that everyone should have one. But when you recognize that all of us are somewhere between 15 and 30% unvaccinated, and it's not for lack of effort, there's something about people's frame of mind that is that needs to be reconsidered. Because I can tell you, and I'm on the record here, if I'm faced with firing staff because they didn't get vaccinated, or having staff to take care of residents in a healthcare facility, people come take my keys. They can have my keys. Because I mean, the idea that I'm going to be asking nurses to leave, I'm sorry, not doing it. And that can go on any public record you want to put it on. But I'm not. I would rather hand over my keys than fire people for not having a vaccine. And I do think shame on them, they should get a vaccine, if you want my personal opinion. It's just like, would you go get the shot? I mean, we say it all the time. But at the end of the day, you got adult decision makers who have a lot of viewpoints, and they're allowed to have their viewpoints. It's still, you know, we're still living there, you know, as far as I know. And I just think that the regulatory intent, however well intended it is, it's reckless. And I think there's a lot of regulatory influences that have ultimately had a very reckless outcome on a lot of people who are really here to do the right thing and take care of people. So,
yeah, and I want to just add to that. The message is not anti-vaccine. It is, we want to protect our nursing home residents from having to displace them to other facilities because we don't have the staff because of the mandate. You know, could there be a twice-a-week testing option? Those are the things that we're trying to work with the state and our associations on. So I just want to be clear on that. It's because of our staffing issue is where we're coming from. Kathy and Greg, I don't know if you have anything you want to add.
You know, I'm just going to echo, you know, I'm not going to repeat the same thing, you know, for St. Luke, but for us, you know, we're a 200-bed facility. We have a high-rise that have 20-bed units. We've had to close down 2 of our 20-bed units because we can't staff them. You know, our census is at 150 right now. It's not sustainable, and we cannot recruit staff. So we need your help. We haven't asked you for your American Rescue Plan money also, but anything that you can do to encourage people to come into healthcare, because we're turning down, that the hospital has people, we can all take them, and then they're going to Onondaga County, other counties, even further away. And these are Oswego County residents, and it's not right. We've got the beds, we don't have the manpower, so anything that you can do to assist us with staffing, to training programs, money for incentives for people to want to come into healthcare, anything would be appreciated.
I don't think Onondaga's staffing ratios are any better than anybody else's. I think part of what you're hearing too is that there are people in this room, the hospital, these facilities, where we're making a choice that we know we're at 2.5 to 2.67 hours per patient day, something like that. We have a mandate coming up in less than a year where we have to be at 3.5. We've always budgeted 3.5, and you try to get to 3.5. We've historically run 3.1, 3.2, 3.3. It's like our collective buildings have averaged a respectable number of hours per patient day. That's what I'm talking about. Everybody's in the same boat right now. But the decision on admissions and the right thing is to not overburden your staff any further. And it actually very much compromises your operations and your ability to cash flow and your ability to do all the things that you need to do. So I don't know that all the decisions being made, these in Onondaga County, for example, this isn't anything against Onondaga County, but just because the Oswego County residents are going to Onondaga doesn't mean they have some resource that we don't have. They're going there and they're probably faced with just as bad or worse staffing situations because it's a highly competitive market, probably more so than here. This is we all get along and communicate well enough. That is not the case in there when you have a lot of downstate owners. You have a larger owner group. They're basically, you got to admit, you got to keep the place open. So it's not like Oswego County residents are getting better care going there. They're probably getting worse.
And let's face it, we're making the decision because it's not safe to admit somebody. It's about our staff, but it's also about safely taking care of the residents. Because, we don't want to be the nursing home on the TV that we see.
And just to add one thing to that, I mean, we're talking about residents, but really the impact is hitting family members of these residents just as much. So if there's a resident who's been displaced in Onondaga County, that means there's a local family that may need to travel down there just to visit. So it's really, the impact is much larger than just the resident population that we're trying to care for at this point in time.
Anybody have questions for us at all? I mean, I think you kind of heard our stories are kind of all the same, just a little bit different, but.
Yeah, just at the county level, I mean, what is it that you're asking for? I mean, from the county itself. I mean, obviously salaries have to go up, and training people isn't going to help if we can't pay them enough. So what is it that you're asking? That's the point. I mean,
immediate short-term relief would be give us some room on the vaccine so that we can work with our staff. We can't be in a situation from here to the end of September where there's a lot of healthcare facilities and healthcare employers faced with firing healthcare workers.
I understand. That's
so that is probably, and there's a lot of other things that are right up at the top of the list. But
is that decision made at the county? That's a state issue, and just specifically what can the county do? I mean, we'd be happy to support you in that endeavor, with the state.
Yeah.
Back, I would think that most people would agree. This is
Collectively, we did have the opportunity. Mr. Church invited us to a forum of local healthcare providers when the discussion around American Relief Funds was taking place, and we like other providers, did submit some suggestions, some projects for consideration that were primarily focused on workforce development. So we ask that you give those due consideration, basically, as you're moving forward in your decision-making process with the American Rescue Plan.
And I think the piece to that I'll stress, and I know I stressed it in that meeting, is speed to market. The time is now. I know that there's a long lead time in terms of when you are able to expand those rescue plan dollars. We can't wait years. We are in the time frame. I think Kathy put it well. if it's incentive bonuses, if it's, I mean, we are putting every dollar we can possibly put on the street to recruit individuals every single day. We have caps on how many CNAs we can train. We're trying to push those numbers as fast as we possibly can. If there's a way to help incentivize those people to go into those training programs as unemployment benefits get less incentivizing, let it help us do that. But we need you're asking a great question. We're asking the local regulatory framework, right? You have a regulatory body you oversee. Try to loosen that up a little bit for us. And is there a way for us to get access to those dollars sooner rather than later?
Even if it's county focused, where can
Absolutely.
the county be more involved? I'm familiar with Monroe County. They have been a little bit more active and involved when it comes down to directly training. Funding to direct, not specific to any provider,
Yep.
but just fund the training, home health aides, CNAs. Do more to get to, so that the county directly is not biased towards any provider, but just, we need to produce healthcare workers at the county level.
And actually, it wasn't that long ago, we had a CNA program that we had to reject because the state didn't give us the time to put the program in place without penalties involved in it. That we, as a legislative body, were going to be on the hook for anybody that didn't complete the training.
Right.
I mean, they provided the money and they said, now you can sign people up, we'll pay for the training, here it is. But oh, by the way, everybody that drops out, if they drop out before a certain date, you pick up the tab for them. So as a legislative body, we're sitting here going, we got no idea.
See, and can I
The date they set for completion, the program couldn't be completed.
Wouldn't even be done.
Well, Stacy said there were other programs and other routes and other funding for it.
Yeah.
So
Yeah.
she wasn't that concerned about it. So there is funding available for that
Right.
already.
And if I can speak to that too, if you don't mind.
Yeah.
We face that same exact challenge, Chairman Krasik. We run those programs and we always build in a 30%-ish rate of people we know they're never going to complete it. We build it into our cost. It's just the cost of doing business. We have to train them. We have to do it. If we don't do it, we don't get the 7. So it's one of those things where I know it's quote unquote not fiscally probably their most responsible thing to do. We got to compete. We got to try to get as many as we possibly can. And I don't know if that's the same for everybody else. But
Because a lot of people don't know what they're getting into. They don't know what it is till they get in the training, and it's like, whoa, wait a minute, I didn't know I was going to do this. And then
we're
we
doing
got
that now.
One other thought, if I could. I mean, if we have this vaccine mandate, what would be the point of training people that don't want to get a vaccine, and how do you go about doing something like that? I mean, I don't know if that's...
We are communicating that to every staff person that we recruit and bring into our program that this is now until state changes regulation, a regulation and a contingent part of your employment in healthcare.
So have you made any approach with Commissioner Alvaroyd on this for workforce? Because I sat in a meeting yesterday and she told us they've got all kinds of money for this stuff.
Who's Commissioner Alvaroyd? I don't know who that is.
Stacy.
Oh, Albert. I'm sorry. Yes, sir. Yes, sir.
You've been gone too long.
Through DSS? I'm not sure I know of a training program through DSS in particular.
It was through the Employment and Training Division
Right.
of DSS.
I'm happy to chat with her.
Okay.
That might be something that,
Rachel Pierce might be a better direct.
Happy to chat with her. Yeah, we're open to any mechanisms to try to build this. Yeah.
Phil's gonna get you that information.
Sure.
But I sat in a meeting yesterday where she told me she has tons of money for that type of stuff.
We'd love to put it to use
Yeah.
tomorrow.
I've pushed for Morris.
No, this
He's a
is
little
hard.
older than I am, so.
I'm just trying to listen to all this, and I see one resource. Can I say something? We have community colleges. We have colleges in this. How can we adapt a training program that you people certainly know and I don't? So we get whoever out of high school, I assume, into a training program that can satisfy the ability to do what people need.
So they do come to our facilities now. We have high school students that have come and they've been able to go back and do on-site clinicals. And we also have some of the OC students. And they're working a little more closely now with the community college. So those people do come through our doors. They do clinical hours there.
That's what I'm trying, I don't understand,
Yeah.
but can we unify the situation where when they get to high school and they're a senior, they got it read into them a little bit of ideas about how they can help.
We actually
Or get involved in work and just go out and work, and they can be trained. We do have, I believe, one of the finest, Xena College and community colleges and whatever else you people would think to train people. And I can imagine a high school graduate at this point, when they first get out, well, they want to do this, they want to be an engineer and all this, which is great. But also, maybe some people want to go to work.
So our Oswego Health, we started going into the schools. I think that's the age you got to capture them. Is at that that sophomore, junior, senior year. Let them know what the healthcare career options are. The CNA is the path to being an LPN or an RN. It's been challenging, to say the least, because again, going back to Joe's comment, there's other industries, retail, hospitality, that are paying $17.50 an hour to start, and it's a lot less work, and that's a real issue for us right now. I've lost, I can give you an example, I lost a 13-year veteran CNA, not just because of the vaccine mandate, but because of real COVID fatigue burnout, and she's going to go to manufacturing, where she's going to make over $20 an hour, and only work 3 days a week, and set her own schedule, and make more money. Again, like Joe says, I can't raise the price of healthcare. We're Medicare, Medicaid funded. We lose $125 roughly per day for every Medicaid resident. That's a state set benchmark. It hasn't been funded for long-term care adequately for over a decade. I can't raise the price. Cheeseburgers, pizza, restaurants, they can do that. We can't. So the COVID fatigue burnout is an X factor that we're really struggling with managing right now. That's added on to this. But we are going into those high schools and trying to promote the path to long-term care and to health care.
We actually have a program with, I think, 6 county school districts where we actually start in 8th grade. We present to 8th graders, here's an opportunity to get into a program. I believe once you complete the program, if you enroll through all of your entire time from 8th grade through senior year, you're like 1 credit away from an associate's degree. And you're guaranteed a seat in whatever program it is to try to get into, whether it's CNA or whatever it is. So we're efforting that every day we possibly can. We work with CCC. President Durant's been great, trying to get more and more connection there as well. And we recruit out of Lemoyne, we recruit out of everywhere we possibly can from a school's perspective.
Well, I don't have the answer. I'm just sure that each and every one of you, it's just like anything else. They have to train for a job, whether it's just driving a truck, whatever.
Morris, I'm actually, I don't mean to take up any more time, but I'm on the board of Health Workforce New York, and they're a collaborative of, different hospitals and healthcare agencies, and their focus, they have like MASH camps for high school students. So they're doing this, they're doing it aggressively. I think the other issue here, though, is what you're hearing from these folks is triggered by COVID, is the short-term, immediate need just to keep up and keep the engines going. But the MASH camps, I'll share with you later on, or I'll give you a call. They'd be a great organization, maybe to connect with Stacy. But that, again, to emphasize, that's more in the long term. Everything you're saying is spot on. So I just wanted to make you aware of that. They're an excellent organization, and these folks work with them. It's just a little bit, you're in a new paradigm now with this pandemic.
The speed to market's really the important part.
But great points, great thoughts.
No, what I'm pointing to, take myself as a farmer. You think I could find people who work? A lot of people who work. Yes, we have a lot of local help. But if I didn't get the 13 Mexicans that come out of Mexico on the contract to do the field work, where would I find them? So I'm just trying to bring up, we're bringing people up here.
Yep.
And as you know, the southern border is wide open. These people are going to have jobs. Some way, some training. It's just, they can learn how to speak English or whatever they got to do. I have 12 of them, and they're great people, wonderful workers. But if we didn't able to contract to those people, we couldn't get workers. We couldn't operate. I'm just trying to see what we can do together to help change things a little bit, to incentivize the situation.
Well, there is no doubt in this county that we have a good collaborative, and for you to show up today is a perfect example of that. I'll give you real quick personal scenario that I was at Oswego Health, I had a serious infection, it took off most of the bottom of my foot. The staff was phenomenal. I was not the best patient, but
You told that dog not to bite you?
I didn't have the dog yet. I got the dog as a result. But when it come time for me to move on, I had a wound back on, and I remember the discharge planner at Oswego Health called the insurance company and come back and said, well, you can go to Utica or you can go to Auburn. And I said, no, I'm not going to go to either one. Well, you don't have a choice. And I said, no, you have a choice. You go downstairs, you call up the insurance company and tell them they can keep paying the bill right here because I'm not going. By the way, I work for a RISE. I know how to be an advocate. So they immediately started calling around, and a few minutes later, they had faxed back and forth, and I went to Morningstar. In fact, I was in the room across, and you had a family member right across the hall from me at that time a few years ago. I had the coldest room over there, by the way. There was ice in there. Good staff, very cold room. I had a quilt, and somebody stole it in the middle of the night. Some lady decided she wanted it. They got it back. But my point with that is, none of this surprises, I don't think, anybody on this committee. I think that you've got the attention of the committee, and we would support anything that you want us to do in going forward with this. I mean, we're just in them baby steps of the American Rescue Money as a legislative body. So if you've submitted that will come up. I do think there needs to be a point of contact. If you want to sit down and set that up with Stacy, I think Phil would set that up. I'd be more than happy to go to that meeting because I happen to be on that committee and I chair this committee. But I think that's a conversation about what is available there, what could happen, and how could that training be put forward at that point. I would recommend that you stay in contact with Ching Chang, and if there's something else that you request, we could write a letter of support to the state, recommending, after discussion of the two tests done. I don't know. If you've got a plan and you want to share that plan, we can bring that back to committee and we can have that discussion here.
Mike, I don't have everybody's email here, but can I
No problem,
this through you?
Happily, yeah, no problem.
But we can put together collectively some highlights and send this to the group here, if we want to go forward with that meeting with the county, with the state, based on our staffing issues. Sure.
This regulatory situation you just mentioned, we don't know enough about it. We should know enough about it. Our elected officials, we got to work on them. We got to change something. We should do it, or attempt help to do it. Right. Let's put it that way.
Yeah. You're in the corner. I keep forgetting you're here.
You can sit right up here with me.
Come on up.
I mean, EMS, I'm the county EMS coordinator, and we're in a very similar situation, and we're going to face the same predicament with if EMTs are to get vaccine as well. I would just offer that you guys have New York State Association of Counties coming up. You're going to be with colleagues from all across the state, and it might be time to start having some of those discussions. We, on the EMS side, it's a very similar situation fiscally, and we have repeatedly been shot down in things brought before the state legislature because there's higher priorities. And collectively, we're saying we need you to tell them we need to be a higher priority. Direct billing is one of the big ones for EMTs, but I think they need to hear it from you guys who are hearing it from us because they're not listening to our voice. So we're asking you to be our voice at a higher level, that they need to pay attention to this and not raise fast food wages. They need to look.
So, one sheet. If you could put together a fact sheet of what the issues are, please do not make me regret my next statement. I am on the NISEC board, Public Health Mental Health. He is on the board of directors for NISEC. If you could help with that, maybe, because it should include the EMT issue. If we have I will tell you right now, if you do much more than one sheet,
Yep.
it's going to become bathroom reading instead of reading it at the meeting.
You
So
can do that.
if you do that,
Yep.
I can get that distributed to that committee, and Phil can share that with people on the board.
When do you need that?
Like right away, because I think it's,
You're going next week.
no, we got 2 weeks.
Yeah, 2 weeks.
You got 2 weeks.
So, a week from today would be ideal, it sounds like?
Yes.
Okay.
If you get that to Phil, he can give it to me. I'll make sure I have enough copies for the committee, and then Phil can send it down.
We know how to get a hold of Renee.
What's that?
We know how to get a hold of Renee. We'll
I don't, because she's always hiding.
we'll put that together.
Okay.
Yeah, we don't have to take
Thank you,
action for
thank
that.
you. I know you brought them in, but I just, thank you for the opportunity.
It's a bigger problem than you think. My son's a paramedic with the Wood Fire Department. He's changed fire departments twice because everybody's so short, they throw money at him. And now Henrietta called him and said, oh, gee, you're not getting paid anywhere near what you're worth. Why don't you come over here? We'll let you have your seniority. We'll put you on the kind of shifts. Yeah, it's a 2-hour drive, but you work 3 days, off 2, then work 2 and off 3, da-da-da-da. I mean, he's considering it because it's the same type of a situation. They just can't hire people. It's a much bigger level, but I understand it.
Thank you all for your time.
Thank you.
We certainly want to work with you.
I understand disasters too. I have a son and 2 grandchildren stuck in Tennessee today. Because of the rain.
Thank you very, very much. I'm sorry for this.
No, it's okay.
That's okay, Shane.
Thank you very much for coming and
Nice to meet you
sharing.
all.
with us.
Thank you for letting us come today, I appreciate it.
Thank you.
Bye.
Take care.
Thank you.
Thank you.
Okay, thank you. I was wondering about this. Thank you.
Oh, you used up most of your time.
I promise, yes, we'll control time and not to keep you under the half hour. Okay, and here are some slides I prepared, and this is the slides you're familiar with, and every month I want to share. And you can see, this is not my first time I point out. This is our beginning first peak. This is our second peak. You can see the density here, and sure you can see this is why not a peak is because not so dense. And this is third peak, and this is the fourth peak. And very interestingly, we have one day over 90 cases a day, and this was the last week Friday. And this peak came unexpectedly and dropped quickly unexpectedly, and I was puzzling. And over the weekend I sit there, surf online, and I at least for me I find some reason why is because this is Delta variant, and the Delta variant came fast and leave fast. If you look at it, because I found that at the Johns Hopkins University there, nationwide the daily new case counts, and you can see a peak in the past 2-3 weeks. The reason was because each peak represented a state, and Mississippi, Texas, Florida came in quick and dropped quick, then moved to another state. Probably here is the same situation. This is just my professional interest, probably, if you say. And the next slide, yeah, this is really reflect our work volume and monthly case. You can see, and we started March last year, and January was the high peak, and this was the last month, and the work volume for our department, if we can say, or much easier to see how the situation changes. Okay, and this is before I go to talk vaccine, and let me stay here talk about one more about the case. And Brian Youth Bureau is not here, and I wanted to compliment him and his team made a good decision, because we have new cases keep coming, and in the county we have many clusters, and almost every children camp have clusters happen. But our Camp Hollis, not a single case, and really Brian and his team did a great job. And I think really at the very beginning, I remember what type of camp he's going to open, and I think at the very beginning he made a very good decision. And this is our immunization rate, and you can see, and our team doing our great efforts, and try to help out in some clinic, and I can tell you, because our flu vaccine also coming, and in our department immunization agenda, October is almost full, and I know one village wants us to go, and we are willing to go, but really we don't have time, and this village is in a unique situation without a local pharmacist, and without, it's quite far away, and immunization rates is good, but still they want us, we understood, but we have to put into October to see, and it's already very, very full. And this is, I wait for this slides for many weeks, and I could never find it until 2 days ago. And you can see this is Oswego County data, and this is the young age 12 to 15, and age goes up, and I'm happy to report it to you. I had the impression always our county immunization rate is lower than state average. Yes, we're still lower than state average as of today, and we are, I can say, constantly 3 points below state average. Like yesterday, state was 54.1%, and we are 51.1. So it's always constantly over a week, 2 weeks, 3 points. But I saw some shining points is, yes, in our county, these two groups were above state average. We're above average for 65 to 74, and the 75 above where we were. And this is the county-wide vaccine clinics our department hold, and you can see this side is the amount of our clinics, and this is the immunization rate. No, not the immunization rate. Immunized individual counts and by months, and we did our most in March, and now we run more clinics, but we perform less. And this one part is understandable. So many people already vaccinated at these bigger clinics, and the biggest clinic, one day we run it, and we run 100. We did like 1,300, and now, yes, we do very less, and that's.
Changing that last one is July. Do you think that's gonna go up or down, or about even for August?
I expect it will go up a bit. This yellow line, we will go up a bit in August.
The last few Wednesdays, they've had 50 or 60 come into their clinic. That's at the health department, which was better than what they were seeing in July.
Yeah, and I think, yes, this will go a little bit above it, and I always want to point to the two people in the way behind it. This clinic, we run clinic increase and the immunization rate, or immunize the people reduce. It's really put a lot of financial pressure on county. And one example I always like to say is we have 7 people drive a 4-county vehicle with 1 trailer and went through the county and the whole day vaccinated only 2 people. Yeah. So this is the situation. Okay, let's change a little bit. If you have a question, just ask me. If not, I'm going to move forward. This mosquito things. Mosquito things. Every year we have this mosquito things, and we always did it timely for make an announcement when we have positive we always work with the state, make a decision to do spray or not, and because the state is probably too busy, and anyway, the information flow is not as smooth as in the past, and it's not as quick in the past, and I just want to share with you. Another thing I want to share with you is probably you may not notice, and in Onondaga County about 2 months ago they announced a virus. It's rare and it causes mild disease, but they announced it. And I was reluctant to make this similar announcement because in our COVID situation, and if we announce a new virus, we'll agitate the whole community, make people more nervous. So we issue a general announcement to say flu season is here, and we want people to pay attention to personal prevention. And but this is still an issue, and I brought it to Board of Health, and I need the Board of Health to give me final decision, because this one time I can make this decision. In the future, I want that we follow Board of Health decision. And the Board of Health, as you know, we have 3 physicians, 1 dentist, 1 vet, and Mr. Karasek is there, and we have retired school administrator, Mr. Eaton. And the decisions they gave to me is, yes, like this kind of rare and not urgent virus don't need to specifically report. Let us report only triple E and the West Nile virus. So I just want to share with you, and it's not probably this year. In the future will happen, and I'm looking forward to your continuous support.
I think on the email chains we had, am I remembering correctly that the state disagreed with the decision that was made by the other county to announce it?
Yes.
So you made the right call.
The state, yes, the state called the commented as ways. So this mosquito things still, and we give you a quick update. Is last Tuesday we did a spray, because so far this year we already have 15 positive triple E so far till Friday.
Whereabouts in the town of Albion do you keep?
Yeah.
It showed up in Albion.
I will touch it. Yeah. And so already we have 15, and mostly it's in the swampy area. And at the Albion, so far we have 2 or 3. If I'm correct, it's 3. And first positive in Albion, and then skip a week or 2 weeks, another positive. And according to state entomologists, they believe because this mosquito is different from West Nile virus mosquito, from Ebola virus mosquito. Ebola virus mosquito can only fly 200 feet, and this mosquito can fly 10 miles. So 10 to 15 miles. So entomologists over the past several years always say Oswego County focus on swampy area. So that's why we always, but we are paying great attention to Albion situation, and we didn't put it lightly, and we keep continue monitor the situation. I'm not to say we will never spray Albion area, but we are monitoring the situation. And another thing is this spray last week Tuesday was successful, and 90% mosquito killed. But look at it, last week we have high temperatures, so many rains, and the situation keep changing. And this I very briefly let you know, and our department activity, and this is tobacco cessation program for many years, and what I want to highlight it here is really, yes, you can see we have this COVID-19 2020, but our activity keep at more than 75% working. And another I want to say is, if you look at here, and I cannot say all Oswego County attribution to this program, but you can see our county's adult smoking rate is reducing fast, and this two data, 2018 data, state just released to us, and 2016, 2018, you can see 2016 we're the highest smoking rate county, and 2018 we're still high, but we're at the bottom fifth, and it's a lot of work, and this is the hardship. My experience work as public health is really chronic disease. Yes, let's do it, and mosquito we can kill 95%, and this chronic condition is so hard to work. And this program started at middle 2015, 2016, and for these 4 or 5 years, and very little change. So this, and every year infectious disease investigation, you can see last year because of COVID-19, and this year, half year, we already reached 4,900. It's already above last year's cases. So I want to let you know. And this really, I still want to see our team is a great team, and they're so dedicated, and I always can bring them together. And this is our internal collaboration, and you can see, and this is environmental health contributed to our COVID-19 efforts, and this is 2020, they contributed over 2,000 hours, and this is 2021, and for the first 7 months, they already contributed more than 3,000 hours. So it's really, I always said to my staff, my team, and it's a great collaboration, and also outside our department, the collaboration is so good. As you know, I always said the local community support us, and tourism, EMO, always very supportive. The last slide I just want to share with you, and you saw this slide last month already, but I just want to share with you. And this is a new program, progress. That's why I bring it here. And as you know, we got this national award, and about more than 2 dozen county in this throughout the state or throughout the country they got this award, but Oswego County is one of 3 they chose to present a national webinar presentation next month. So it's to me this means much more than this lake. It's really we are one of 3 they chose us. And, so I think that's all my presentation is less than half hour. Thank you.
Thank you. Appropriate motion?
Second.